Welcome to the Head-to-Toe Physical Assessment Guide. This comprehensive tutorial will walk you through each step of a systematic physical examination, covering all major body systems. We'll demonstrate proper techniques, normal findings, and important assessment points. Before beginning any physical assessment, always perform hand hygiene. Clean hands prevent infection and show respect for patient safety. Now I'm ready to approach the patient. I knock, wait for a response, and enter. Hi, my name is Jenny, and I'm a nursing student. I'll be performing a full head-to-toe physical assessment today to better understand your overall health. Could you please confirm your name and date of birth? I check the patient's ID band to verify identity, ensuring it matches the chart. Next, I ensure privacy by closing the curtain or door and making sure the patient is comfortable and covered appropriately. Before touching the patient, I review their chart and report to get familiar with any medical history, diagnoses, or ongoing concerns. Now I begin by observing the patient's overall physical appearance, their posture, grooming, affect, skin color, body position, and signs of discomfort or distress. The assessment begins with a general survey. Observe the patient's overall appearance, level of consciousness, behavior, and vital signs. Note any obvious signs of distress or abnormalities before physical contact. For skin assessment, observe color, temperature, moisture, texture, turgor, and any lesions. Systematically inspect and palpate the skin, noting any abnormalities in color, temperature, or texture. Examine the head and face, noting symmetry, shape, and any abnormalities. Inspect facial features, skin condition, and assess temporal arteries for tenderness or prominence. Begin eye assessment with external structures. Check eyebrows, eyelids, conjunctiva, and sclera. Assess pupillary response, accommodation, and conduct basic vision tests. Test pupillary light response, accommodation, and extraocular movements. Note Perla assessment, pupils equal, round, reactive to light, and accommodation. Test the 6 cardinal positions of gaze. Examine external ear structures, noting position, shape, and any lesions. Assess hearing using whisper test. Note, otoscopic examination requires additional training and is not covered in basic assessment. Inspect external nose for symmetry, deformities, and patency of nares. Check for tenderness over sinuses. Assess ability to breathe through each nostril. Examine oral cavity including lips, gums, teeth, tongue, and pharynx. Note moisture, color, and any lesions. Check tongue movement and uvula position. Inspect neck for symmetry, visible masses, or pulsations. Palpate for tracheal position, thyroid gland, and carotid pulses one side at a time. Test neck range of motion in all directions. Palpate lymph nodes in proper sequence: preauricular, postauricular, occipital, tonsillar, submandibular, submental, cervical chain, and supraclavicular. Begin neurological assessment with mental status evaluation. Test cranial nerves I through V, olfactory for smell, optic for vision, oculomotor, trochlear, and abducens for eye movements. Continue cranial nerve assessment with 7 through 12, facial for smile and frown, vestibulocochlear for hearing, glossopharyngeal and vagus for gag reflex, accessory for shoulder shrug, and hypoglossal for tongue movement. Assess sensory function through light touch, pain, temperature, and position sense. Test motor function including muscle strength, tone, and deep tendon reflexes. Begin cardiovascular assessment with inspection for visible pulsations, jugular vein distension, and edema. Palpate apical impulse and note any thrills or heaves. Auscultate heart sounds at all 4 cardiac areas: aortic, pulmonic, tricuspid, and mitral. Note S1 and S2 and any extra sounds or murmurs. Assess peripheral pulses bilaterally: carotid, brachial, radial, femoral, popliteal, dorsalis pedis, and posterior tibial. Check capillary refill and extremity temperature. Begin respiratory assessment with inspection of breathing pattern, rate, depth, and effort. Note chest wall movement and symmetry. Palpate for tactile fremitus. Perform chest percussion in systematic pattern, comparing sides. Note resonance versus dullness. Identify diaphragmatic excursion through percussion. Auscultate lung fields in systematic pattern, comparing sides. Listen for normal breath sounds versus adventitious sounds. Note intensity and quality of breath sounds. Begin abdominal assessment with inspection for contour, symmetry, and visible peristalsis. Auscultate bowel sounds in all 4 quadrants before palpation. Perform light palpation of all four quadrants, noting any tenderness or masses. Begin in non-tender areas and move systematically. Perform deep palpation to assess organs and deeper masses. Check for liver span, spleen, and kidneys. Note any tenderness or abnormalities. Assess upper extremities for strength, range of motion, and symmetry. Test major muscle groups and joints. Note any deformities or limitations. Examine lower extremities for strength, range of motion, and symmetry. Test major muscle groups and joints. Check for edema and pulses. Demonstrate proper technique for testing range of motion in all major joints. Note normal ranges and any limitations or pain. Inspect spine for alignment, curvature, and symmetry. Palpate spinous processes and paraspinal muscles for tenderness or spasm. Test spinal range of motion, including flexion, extension, lateral bending, and rotation. Note any limitations or pain with movement. Assess gait for smoothness, symmetry, and balance. Observe arm swing, step length, and base of support. Note any abnormal patterns. This completes our comprehensive head-to-toe assessment guide. Remember to document all findings thoroughly and report any abnormalities promptly. Consistent practice will help you develop proficiency in these essential assessment skills.